Good afternoon, y'all. Welcome to our series on the Pride series from Care to Prevent. My name is Takesha, and today I will be covering back to sex basics. Yay! So in sex basics, we will be covering some slightly talking about testing, STI infections, proper use of condoms, instructions on proper condom use, what safe sex looks like, preventing HIV, getting tested, and we're also going to cover some things about assault. And at the end of the presentation, we will have some resources. I'm just going to cover a little about some things about you should know about testing, because more of the section will be covered by Mira tomorrow on Friday. The things you have to know when you go to get tested: know the locations where to get tested at, know the importance of why you should get tested. Knowing your status could not only save your life, but also as well as your partner's life. STI infections. Having unprotected sex can risk unplanned pregnancies, but as well, it can risk having STI infections like BV, known as bacterial vaginosis, gonorrhea, trichomonas, syphilis, chlamydia, and also HPV, the human papillomavirus. Yes, you can pass human papillomavirus to a man, and a man can pass it to you, and it's also known to cause cancer, cervical cancer. The proper use of condoms, right? So you have to know the basic uses of using condom. First step is making sure you're getting the right size. Yes, the right size is important. Why is it important? That's a good question. Ask yourself, if your condom is too tight, do you have extra room that is too loose? These are signs that your condom that you do not have the proper fit. If the condom is too tight, please go up a size. And then if it's too loose, please go down a size. Not everyone can wear a magnet. If you're not wearing the right size condoms, you're putting yourself and your partner risk at STI infections, or HIV, or even unplanned pregnancies. So on the next slide, we will go over additional information on proper condom use, such as magnum condoms are just wider. They're not longer. Just because you use a magnum condom doesn't mean it's the right fit for you. So keep in mind, having the right fit condoms make a difference on preventing unplanned pregnancy, STI infections, and also HIV. Problems with a condom Problems with a condom that if it's too big, it might slip out. Problems with a condom that if it's too small, it could break. Then what's the point of having it? You don't want a condom to break during sexual activities. Make sure that you have the right material. So if you're a person that's allergic to latex, please get latex free. Also try out different kinds like ultra thin, rivet stuff, flavor, just different types of condoms. So if people who do not like using condoms, but you know you need to use the bare skin ones, those will give you the feel of like you're not wearing any condoms at all. Internal condoms may be used for vaginal and anal sex, also called female condoms. When you using the internal condoms, please do not use a male condom. Before opening any package, very important, check the expiration date on these condoms. Yes, condoms might do last in your wallet for a great while, but they still, according to the CDC, you have to use them by the expiration date. Instruction, I'm going to talk about the instruction used for female condoms, okay? So when using the female condoms, please carefully open the pack where you're not just tearing it with your teeth, where you tear the condom. The thicker inner ring in the close end is used to place inside the vagina, and the thinner outer ring stays on the outside. On the next slide, you will see some pictures of the demonstrations of how it's used. So so you can see the pictures. When inserting the condom, please find a comfortable position while holding the condom at the close end. Squeeze the side of the ring with a thumb and 4 fingers and insert into the vagina. Use your fingers to push the inner ring in as far as it will go until it rests onto your cervix. So here are the pictures I promised. As you can see, the opening of the package right here. And here goes the outer ring right here. That goes into your, this right here goes into your vagina. And this part right here, this is supposed to rest on the outer, on your outer, the outer part of your vagina. You see how as she's squeezing, the person is squeezing it right here. This is how you do it. And then inserting it right here. When the person that's inserting it, so it's going it's gonna go all the way back. So when you inserting it, please make sure it's not twisted. It's not twisting. The outer ring should remain right here like this on the outside of the vagina. So when you're going to, when you're about to have sex, guide your partner penis into the opening area. You see right where the hand at. So if you start to feel your partner penis slipping in between the walls of the vagina and the condom, so if it starts slipping in this area, please stop and try to readjust it. Instructions on male condom use, as for the safe, some of the instructions are the same for the female. Please do not tear the package open with your teeth. Place condom on hard, erect penis. If you're uncircumcised, please pull back the foreskin first. Pinch the air out of the tip of the condom. Unroll the condom all the way down the penis. After sex, but before pulling out, hold the condom by the base so it doesn't slip off. Then pull out while holding on the condom. So you don't want to just yank it off while you're still in the vagina. No. So here are the pictures, instructions that you see. This is the condom coming out the pack, right? And the hand is pinching the tip of it right here. And so 3 is showing where if it still have the pinch, and now it's rolling it all the way, now it's all the way down. And this is, once it's done, is discarded. So what safe sex look like? Safe sex, use all available safe sex kits such as condoms, lubes, and PrEP. Safe sex kits reduces the risk of HIV. Safe sex kit reduces the risk of STI infection. Safe sex reduces the risk of unplanned pregnancy. PrEP prevents HIV transmission, but it does not prevent STI infections or pregnancies. Yes. PrEP prevents HIV transmission, but it doesn't prevent STI infection. So you still can get chlamydia, gonorrhea, BV, trichomonas, and you still can get pregnant. Preventing HIV. PrEP, when used correctly, prevents HIV. Other ways to prevent HIV is masturbation, oral sex instead of anal or vagina. Properly using condoms can prevent HIV. Getting consent with your partner, whether it's a new partner, whether it's a long-lasting partner, having sex, you always want to get consent. Before having sex with your partner, you always have to give consent. If your partner is intoxicated, they cannot consciously consent. No, they cannot. I don't care what you say, what you think, but your partner cannot consent while they're intoxicated. Consent must be enthusiastic and continuously, and can be withdrawn at any time. So if the partner's saying, is smiling and giggling and is going forward, but when it goes time for it and you take off your clothes and the partner says no, you step back and let it go. No, it means no. The partner can't withdraw at any time. What is sexual assault? Sexual assault is unwanted sexual behavior that is performed against a person's will. Anyone can be sexually assaulted. Anyone. Kinds of sexual assault includes forced intercourse, oral, vaginal, or anal sex, sexual and unwanted, fondling, molestation, and incest. So yes, anybody can be sexually assaulted. Yes, you can't force somebody can't force you into oral sex. So that is considered a sexual assault. If somebody is touching you inappropriately against your will, that is sexual assault. In the case of sexual assault, what do you do? So if you were sexually assaulted, please go to the emergency room for care, um, care and prophylactic treatment, okay? Contact your local police. Please fill out a police report. If you do not know the status of the assaulter, you will need PrEP and HIV and STI testing. For those who may become pregnant, take a Plan B if the assaulter did not use protection. Please, if you were sexually assaulted, please do not sit in silence. I recommend that you seek out help. Do not go through this alone. I know it's a bit much, but please do not go through this alone. If you were assaulted, please reach out for help. Resources. The resources that I have is from cdc.gov, Prep for Love, and www.rain.org. This is for sexual assault, www.nsvrcw.com for sexual assault victims. Thank you for listening to the presentation.